actually quite interesting or even exciting because we see very high response rate. Now let's talk about the TKI-naive, meaning the patient may have some chemotherapy, and actually approximately 20% of those patients have prior chemotherapy, but then they never be exposed to other TKIs such as crizotinib. So in this population, 160 patients in total, the tumor response rate is about 88.8%, which is close to 90%. And then the median progression-free survival is actually 45.6 months, and the duration response is actually 44.2 months. So that is actually, very impressive. But then on the patient who have TKI treated, meaning that they had prior exposure to TKI, and they may have some exposure to chemotherapy as well. About 37% of them had prior chemotherapy exposure. And then the tumor response rate is lower at about 55.6%. But there's one interesting point. There is a well-known resistant gene, it's called the G2302R gene. And then out of the 13 patients with this so-called resistant mutation, they were able to document that 8 patients responding, giving you 61% of responses. Now, but then if you look at the median progression-free survival, it is actually 9.7 months, and the duration response is about 16.6 months. So overall, I think that this actually demonstrates the efficacy of this drug. So we have to put this into the framework where we are with the ROS1, and then starting from the very first paper by Alex Shaw on crizotinib, it's only on 50 patients, and the median progression-free survival of this 50 patients on crizotinib was about 19.2 months. But since then, we actually had, take a long way. Now we have other TKI, including Taletrectinib, Taletrectinib, and both are actually giving you a pretty good efficacy. Of course, we don't have a randomized study so far to say that which one is better than which, and I don't necessarily encourage that. But then I think that any one of these so-called second generation TKI probably is better than crizotinib in terms of their progression-free survival and response rate, and especially on the CNS efficacy. By the way, on the Taletrectinib, for the TKI-naive patient, the CNS intracranial response rate is actually about 75%. Which is also quite good. So in a sense, I think that Taletrectinib now can be considered one of the options for first-line ROS1 positive lung cancer therapy.